welcome everyone. Thank you for joining us today for this really important conversation. I am Deanna Bryan. I am the program manager at Hope for HIE, and today we are diving into the findings of a survey examining dental health and disparities, especially within our HIE community. So we're thrilled to welcome Rachyl Adams, who is a DMD candidate at Boston University Henry M. Golden School of Dental Medicine. It's a long name. Who she's been working with this research under the guidance of Dr. Matthew Mara, DDS, who we had on, believe it or not, a year ago. And he's the one who spoke to our community about the survey and gave some of our HIE families an opportunity to add their input. So now, a year later, we're here to listen and learn about the findings, learn more about the research that took place. And it's a great opportunity for those of you who are joining us to ask questions and just discuss ways that we can advocate for better dental care access. So if you're here, drop your questions in the comments. And in the meantime, we'll get started. So thank you, Rachyl, so much for joining us today.
Thank you so much for having me.
Yes, before we get started, I would love for you to just introduce yourself a little bit more to our community. So if you don't mind, just taking a minute to provide us with a brief career overview where you are at right now, and then if you don't mind adding how you developed a special interest in exploring kind of dental health and disparity, especially as it pertains to our HIE community.
Yes, thank you so much. So as just said, my name is Rachyl Adams. I'm from Northwest Indiana, and I went to Indiana University for undergraduate. There I studied human biology, and then I always knew I wanted to go to dental school. So I went to at Indiana University, applied to dental school, then ended up at Boston University for dental school, which I've absolutely loved. I'm on my 4th year here. So I graduated in May as a general dentist. And then beginning in July, I started Harvard for my orthodontics residency. So I'm going to go on to be an orthodontist, which I'm very excited about. So when I was at Indiana University, I became great friends with a young adult with autism. Her name is Adria. So she was diagnosed with autism and cerebral palsy as a young child. And we met at IU and we started engaging in weekly coffee dates. And I just learned so much about her. And I also learned how she was advocating for other individuals with autism and developmental disabilities. And so I absolutely loved our time together. And when I came to Boston University, I started getting involved with lunch and learns. So lunch and learns are a way that we supplement our education in dental school. It's student ran, and we kind of pick guest speakers to come in and talk about things that they don't really touch on in our curriculum. So I had Adria join, and she talked to all of Boston University Dental about how to treat individuals with autism and individuals with developmental disabilities. So I was talking to Dr. Mara, who's a member of the medical advisory board for Hope for HIE. And I was telling him about this passion of mine, and he told me that he was interested in starting a research project that looked into HIE and how it interacts with oral health and how the dentist kind of fits into the big picture. So I said that sounded amazing and I would love to participate. So that's kind of how we got here. And I'm just so happy that we had a successful survey and we got a lot of feedback. And I'm very excited to be here today and share that information with all of you.
Yes, thank you so much for being here. We're excited to listen and learn. And I guess before we jump into the findings, I would love to provide just a little bit more context. So as you kind of already said, a year ago, it's crazy how time flies. You assisted, as you said, in spearheading this research project to identify kind of like the what's and whys behind dental disparities, specifically for those who have suffered a brain injury, and how that has consequently contributed to challenges in accessing dental care, and the specific oral motor dental health issues that can potentially develop as a result. So as I said before we get into the findings, if you could summarize for us kind of like the impetus or motivating force behind assembling this survey, kind of the goal behind it, if you will. And then if you could delve into some of like the methodology and data collection and remind some of our families, particularly those who maybe weren't involved in that input, how you got your answers, how you got your research answers to explore.
Yes. Okay, so last year we did launch the survey. It was available like January, February of last year. So we were always, me and Dr. Mara are both very passionate about research and advocating for all types of patients. And for me, it was definitely a priority to incorporate the medically complex patients into my career. So that's kind of the why. We also noticed that there was a paucity of research and literature describing the oral health considerations and the role of the dentist as a member of the healthcare team for medically complex children and individuals with HIE. So we kind of wanted to fill that gap. So the goal of our research was to highlight the current status of oral health, the current perceptions of the oral health needs, and also the barriers and facilitators to receiving dental care as described by those caregivers of children with HIE. So there were two parts to our survey. Two parts to our research. So we started with the survey, and at the end of the survey, we also had a unlinked survey. So people's confidentiality was not leaked into the survey. So we received individuals' names and their email addresses, and we could reach out to them to also schedule an interview where we were able to learn a little bit more about like the in-depth, the lived experience through the interview. But today I'm mostly going to focus on the survey. But the survey was a 32-item oral health self-report questionnaire, and it was designed for parents, legal guardians, and caregivers of children with HIE. It was posted through RedCap and then available in the Hope for HIE Facebook page. So it was available for 4 weeks, and we did receive up to 262 responses, which we're very excited about. Yeah.
That's amazing. So I think now is a good time to share your screen, right? I know you came, you have a presentation of findings that you're going to put together here, and I will put that there, but then I'll hide it so we can see. And I will let you kind of go through your presentation and walk us through kind of the summary of the findings of the survey. And then at the end, any next steps and what this may mean for future research.
Yes. So like I said, we were super excited that we did get up to 262 respondents, and 99% of those were from parents of a child with HIE. And we also saw that 76% of our respondents lived within the United States. We had 39 states represented, and we had 5 continents represented. And next slide. There we go. And then can you see the slide 2, Dash, or is that in the way of?
We see, all we see is the child developmental delays, and then that. Oh, but yes, there is, if you press next slide, there is a link to the next one, but.
Okay. But the slide 2, it's not covering the 42% severe.
Nope, we see it. We see
Okay,
it.
perfect. On my end, it's covered, so I wanted to make sure.
Got it.
Whole thing.
We see the 42%.
So we did see that 42% of our parents reported that their child had severe developmental delays, and 19% said moderate, 22% said mild. As far as nutritional intake, this was very important to us from the dental perspective because like how you eat, it definitely affects your mouth and your oral cavity. So we found that 65% of individuals received most of their nutrients orally, and then 34% were mostly fed by tube feeding with NG tube or G tube. So from a dental perspective, when children are eating more orally, that's how you get there's sugar in foods, and the sugar's in the oral cavity. So the sugar will interact with the bacteria that's naturally in the mouth and cause acid, and then that acid will act on the healthy tooth and cause cavities. So we saw that 36% of the children had a cavity. And if you relate this to the CDC reported data, this is a little bit lower than what you'd expect, but it's interesting because a lot of the members were NG or G tube fed. So we're not really certain as far as we don't really think that there's more cavity prevalence necessarily in these medically complex patients, but that's something that we observed. We also observed that 68% of the children's teeth were brushed 7 days a week. So we note that there are some barriers to oral hygiene, but we applaud all parents for doing their best to keep their children's teeth clean. We know it's not always an easy task. So my recommendations as far as brushing, I think it's very important to make sure that you pick the right soft bristle toothbrush. And then also you can use an electric toothbrush or a manual toothbrush. I know some kids really like the pulsating feeling of the electric toothbrush, and then others may not really like that extra sensation and be a little more sensation adverse in like the manual toothbrush. I also really encourage parents to try different fluoride toothpastes. So maybe an unflavored toothpaste if your kid really doesn't like the flavor of mint or bubble gum, or if they really like mint, then go with that. We also encourage parents to try to incorporate fluoride rinses especially if brushing is harder, and if they're able to swoosh and spit and everything, then that could be a great way to supplement your oral hygiene. Also, letting your child play with the toothbrush is nice because it can help desensitize. So I know a lot of kids don't really like the feeling or the sensation of brushing. So if you let them play with it, kind of make it not something scary and new that's going in their mouth, it can help. Also try and maybe make the activity a little bit more fun with a timer or something that so kids can see that the end is near and it'll be a little bit more fun. We did see that 81% of the children had been to the dentist, so we were very excited about that. And we do recommend that all parents, if possible, take their child to the dentist by their first birthday or around the time of the first tooth eruption. Also, you can try and do recalls every 6 months or more often. Maybe your dentist recommends that 3-month recalls work better for the child. There's a little bit more exposure there. Also, maybe then there's a little less pressure to get everything done in one appointment because I know any office visit can be stressful for a child, and we want to make sure that we keep it as fun as possible. Also, we recommend if your child is younger, then they could do the lap to lap exam at the dental office. So that's where the child is sitting in the parent's lap, and then the child's head is leaned back into the practitioner's head or practitioner's lap. So the knees are facing each other between the adult parent and the provider. And so if you lean the child back, you can practice that at home, maybe with your partner or a family member or something. And you can also practice reclining your child at home in the couch or any other position just so they're more comfortable to leaning back. But also, we know that there are mobility issues, so this is not feasible for every child, but for those that it applies to. Also, you can practice opening wide at home. So practice just that sensation of opening your mouth so then the dentist can peek inside. There's also a lot of videos on the internet that I think are super helpful. They're on YouTube that kind of talk a child through what will happen at the first dental visit. You can kind of find some animated ones or ones that I know a lot of dental students even make those just to kind of help with exposure. Also, we know that waiting time can be very hard. And sometimes the dental offices are busy. I'll talk about that a little bit more later, but I really highly recommend bringing your child's favorite toy to the appointment or something like that to kind of keep them entertained. And then, so we did see that the biggest barrier to receiving dental care was that parents reported they were unable to find a dentist that they were comfortable treating, or unable to find a dentist that was comfortable treating their child, which we're very sad about. Like, we want all dental providers to feel prepared to treat any child, especially those with medical complexities. So we're really hopeful that with future like research like this that demonstrates that there is a barrier and not everyone's able to find a dentist that they're comfortable treating their child. And so we want to work with dental education to improve and make it better for future generations. Also, we recognize that data like this, while we can improve the dental education standpoint, there are already dentists that exist in this world. So we really encourage all parents to try and like be a coach for their provider, and through little experiences and exposure, hopefully this can improve. So those were our main results. If anyone's interested in more results, the paper was published in Special Care in Dentistry. So that's available on the internet, or me and Deanna can help you get access to that paper if you're interested. And then, so for our next steps, we're really interested in reviewing those interviews that I talked about. So today I talked about the survey data, but we're also looking into the interviews. So we conducted 10 interviews and we're interpreting that. And then also one of my colleagues, Audrey, is working on focus groups for oral health resources. So we are requesting any parents that are interested in participating in focus groups to review those oral health resources. We would love to hear parent feedback and kind of hear if it's the information that parents and caregivers actually want to read or want to see, or if there's any holes in our resources that we can fill with good information. Because our focus is really community engaged research and we want to hear all of the parent stories.
Yes. That's amazing. So when this all comes into fruition, that's something that you and I can talk about, and then establish a way for our families to get involved in one of those focus groups. Because, as you said, you had what was close to like I'll just say 250 responses. I would imagine a good percentage of those families would be very interested in going over some of those resources, and
Yes,
that's what we love a lot about our communities, that they're very involved.
it's amazing.
Patient family input is kind of at the core of what we do, along with support. So this is all very exciting, and we're again grateful that there are providers and people out there like you who are working so hard to identify some of these gap areas, and then have some solutions in order to make this dental care and oral health more accessible to our families.
Mhm.
Along those lines, as someone who has been in school for a long time and has another 3 or 4 more years to go, I'm sure you've been exposed to a lot of resources. So we always love to ask our providers who attend these Q&As. I'll start with the advocacy portion first. How can parents and caregivers, in your opinion, advocate for their children to receive equitable dental care?
Mhm.
And then, do you have any resources that are available to support them in this endeavor? I know that you're working on creating some, but do you have any kind of pre-existing ones that you would like to throw into the mix for now?
Yes. So I want to start by admitting that this is definitely a challenge, but I'm confident that parents and the caregivers are the best advocate for their child. From my perspective as a dental student, the parent knows the child the best. So I think the most important thing is stress reduction protocols. So
Mm.
maybe you book dental appointments at first thing in the morning or after mealtime, like kind of know when your child would like be a little bit more receptive to appointments, and when they're most cooperative. We also recommend that maybe your dental appointments or any other appointments are broken down into little chunks. Like I said before, everything does not need to get done in one appointment. Sometimes it's okay if the patient just comes in and sits in the dentist's or doctor's office and just kind of chit chats with them or
Mhm.
gets a little exposure. So it doesn't need to be treatment every single day. Or you could get longer appointments and move a little slower, or schedule times when the office is a little less busy. I think that you could call the provider and see if maybe Tuesday mornings the office schedule is a little lighter. So bring in your child
Mhm.
during those times. Um, I also know that there's a lot of layers like dental equipment and mobility. Like the chairs are not always the best for individuals with wheelchairs or who with a lot of like it's tight quarters and it's hard to maneuver around that sometimes. So definitely
Yeah.
it's hard, but we as providers want to do our best to handle things as they are and do our best in any situation. So definitely collaborate with the provider, provide feedback to the provider and help them learn. Like I said, there's all we're going to try and improve the way that future providers are trained, but the current providers, the ones that are out there right now, they can really only learn through experience, and we want to acknowledge that. Dental education will hopefully continue to evolve to help future care providers, but we want to learn through the interactions, and research is so
Mhm.
important because it increases the understanding, and we hope that our resources can help train those future providers. And we think that's the value of the interview. So I don't have necessarily any current items that I can share with the families to help with that, but we're hopeful that our research will kind of be a leader in that. Also, like as a rising orthodontist, one day in 3 years from now, I'll be an orthodontist, hopefully. I really want to make sure that I treat all individuals, regardless of medical complexities or any diagnosis. Dr. Mara shared with me the story of Emmy and Dawn. And for members of the community who know, Emmy received braces and she's a child with HIE. And you could just see that through the pictures, whenever her teeth came together, her smile got even bigger. So
Yeah,
definitely like advocating for all children to have equal opportunities and access to care. We just hope that through the interactions with the parents and the providers, we can kind of get in the right direction.
absolutely.
The American Academy of Pediatric Dentists that I think is
Oh,
an
great.
incredible resource, and the CDC, like those are they have awesome resources for pediatrics and things like that. Um, while it won't be HIE specific, those are definitely valuable. Also,
Yes.
as far as dental disparities, I know Dr. Mara touched on this a little bit too a year ago when he spoke, but most of those dental disparities are like research has shown that they're related to an individual's zip code and the color of their skin.
Yeah.
So we don't really know how different medical complexities play a role in dental disparities at this time. But we do also note that our survey was only available in English, and we did mostly receive responses from white Americans. So that does not capture the full picture of HIE, and we acknowledge that as well.
Yeah.
Also, like I said, the interviews will share more of the lived experiences, and then hopefully the focus groups will improve the oral health resources. And also, I just really want to encourage all parents to share their stories, especially within, like, I love how the Hope for HIE community is so engaged, and they really help to build community. So definitely keep sharing stories internally. Also, I just want to acknowledge that we're all humans and learning. So doing our best to advocate for one another and continue to improve our education system is so important. And thank you so much for letting me be here today. And thank you so
We're
much,
so grateful.
Dr.
Yes,
Mara
thank
and
you.
Betsy, also for helping coordinate this.
Of course. And we look forward to talking to you again. And for everyone in our community who kind of knows the drill, we take this, we put it on our YouTube channel under our Medical Advisory Board Educational Series playlist. We distill it into some key takeaways, easy to read, accessible versions of this. And then we'll also turn this into a more detailed blog as well. So all of the resources that you just provided, like the American Academy of Dentistry or CDC, those will all be available and linked on that blog for those of you who are interested in visiting there and learning more. So thank you, Rachyl, for joining us today. And I just appreciate everything. So thanks everyone for joining. And of course, if there's any questions, just reach out to me, Deanna at hopeforhie.org, and I can always forward those questions to Rachyl, and she can give you some words of wisdom as well.
Thank you so much. I hope everyone has a great day.
Yeah.